From 12 News, this is Newsmakers.
New cases of COVID are again on the rise, as are hospitalizations. With holiday gatherings bringing more people together, health officials are urging everyone to get vaccinated and get their booster. But so far, Governor McKee has been reluctant to reissue an indoor mask mandate.
Whatever it is, right now we're not ready to do that. We're certainly relying on the people of the state of Rhode Island, as they have with the vaccination rate, to personally make the right decisions for them.
This week on Newsmakers, the perspective from inside Rhode Island's largest hospital and emergency room as COVID cases are surging once again. Welcome to Newsmakers. I'm Tim White alongside 12 News politics editor and my colleague in Target 12, Ted Nesi. And joining us via Zoom, we have Dr. Mitchell Levy. He's the director of critical care medicine at Lifespan, and Dr. Stephen Traub, emergency medicine physician at Lifespan. Gentlemen, we know you are busy. Thank you so much for your time.
Thank you. My pleasure.
Dr. Levy, we'll start with you. We are entering a fourth surge. From your perspective, what is different this time?
That's a great question. And I think that the primary difference is we have not only a surge, but we have a severe shortage of critical care nursing and nursing in general. And that shortage is true not just nationally, but globally as well. So it's the combination of yet another surge and a dire shortage of critical care and general floor nursing.
When you use the word dire, that's a pretty significant word. What does dire mean? How short-staffed are you, particularly, it sounds like, with nursing in critical care?
Right. So we are in critical care. We're down 31% of our nursing staff in critical care is short. And I think that's one of the most severe in the country, unfortunately. So that means we're running with a little less than a third of our usual, we're running with about 2/3 of our usual critical care nursing staff.
Dr. Traub, I'm curious, you heard Dr. Levy there say 31% shortage, might be the most severe in the country. What is driving this exodus from your perspective? What are you hearing?
So for this, I would rely a lot on what I hear from my nursing colleagues, that many nurses they're tired, they're burned out. Many of them have elected to take opportunities with travel nursing services. It's led to a lot of flux within our labor pool. I will say, I think that in our emergency departments at Lifespan, our nursing leadership has done an outstanding job of trying to recruit and retain as many people as they can, but it's a very difficult market. And as Dr. Levy had mentioned, this is leading to significant shortages. It's leading us to close beds that exacerbates an already difficult crisis, particularly as we look into the COVID surge. Right now at Rhode Island Hospital, our numbers, our volumes are actually less than we would generally see at this time of year. But because of the nursing shortages, we're just having a really difficult time seeing everybody as quickly as we would like.
Dr. Traub, I want to stick with you for a moment. So we're taping this Friday morning. Things can move pretty quickly, as we know, during the pandemic. But can you talk about recent days in the emergency room and in the emergency department? Is it steady? Are you feeling the fact that there's an upsurge in a growing number of COVID cases, as well as I know flu is starting to circulate, et cetera? Or is it sort of a stable but elevated situation?
No, it's growing, and it's growing slowly, but it grows in spikes. And there are days we had a day yesterday where we actually were able to see patients pretty effectively, and then we can follow that with a day that we have difficulty seeing patients quickly. For instance, this morning, because of the closed beds within the hospital, we had about 25 admitted patients who were holding in the emergency department, and those are beds that we can't use to see patients who are in our waiting room. And we are working as an organization to try to streamline that process as much as we can. But it's, as Dr. Levy had mentioned, the circumstances are challenging.
And Dr. Levy, let me turn back to you on this. As Director of Critical Care, you look across the beds that are available at Lifespan, and I know we've learned a lot, including that the staffed beds is so important, which with the staffing shortage, I know that's an issue. Can you talk about the current amount of critical care and intermediate care beds you have available across Lifespan, and how many are being utilized, as we talk Friday morning?
Right. So we have approximately 180 critical care and intermediate care beds across all of Lifespan, which includes, obviously, Rhode Island Hospital, the Miriam Hospital, and Newport. And of those 180, we're probably about 20% down. Or I should say that 20% of the beds are unstaffed because of the critical care nursing shortage. So we're asking our nursing staff, who are truly heroes throughout the pandemic, to step up and do beyond what's expected and cover longer hours. And we still maintain a 1-to-1 or a 2-to-1 ratio in terms of nurse-patient ratio, but we're still asking them to work longer hours.
Dr. Levy, the patients that are coming in who are COVID positive to receive critical care, are they generally vaccinated or are they generally unvaccinated? What type of patients are they?
Well, this is one of the biggest challenges for the nursing staff, my critical care fellows, and for the attendings, and that is that the vast majority, we currently have 10 COVID positive patients in my intensive care unit, and 9 of them are unvaccinated. And there's something that's well known in the field called compassion fatigue. And to be honest, it is difficult to care for people who had the opportunity to be vaccinated and chose not to be vaccinated. Now, I will quickly say that it doesn't stop us from providing the highest quality care for these folks. We take care of people who attempt suicide, who drink too much, who overdose on illegal drugs. So we're used to caring for people who are their own victims. It's just right now seeing another surge that's primarily amongst the unvaccinated is very challenging for all of us.
And just one more before we bring Dr. Traub back in. Dr. Levy, you mentioned that, so you have one person of the ones you mentioned in the ICU who was vaccinated. Are you seeing evidence of the decay in immunity we've heard about from folks who were in the very, very early wave of vaccinations, who maybe don't have as much protection now as we get 6, 7, 8 months out from those shots being administered if they weren't boosted?
Yeah, unfortunately, no, I haven't. And we see people we've seen people with boosters who get critically ill, and often these people have what we term comorbidities. So they're diabetic, they're hypertensive, they're obese. So there are other factors that go into it, but unfortunately, we're not really seeing this in vaccinated people because of the decay and the time since their last vaccine.
That's interesting. Dr. Traub, so we just had, we're a little past 2 weeks out of Thanksgiving, which obviously a lot of people gathered then. Now we're looking ahead at the Christmas holidays and New Year's. We know people are going to gather. We know that does cause spread. How concerned are you about the outlook over the next, 3 to 4 weeks based on the baseline you start from where you're sitting today?
So I think I'm pretty concerned right now, and I think a lot of what will happen over the next 3 or 4 weeks will just depend a lot on how we as a state treat the next several weeks. I think that masking any time that you're indoors will reduce the spread of COVID. If you are a carrier, and there's evidence that even a level 2 mask can protect you to some extent if other people have COVID. It's certainly not as strong as an N95, but it provides some level of protection. I think taking caution, gathering with people who are vaccinated, making sure that you distance as often as possible. These are all things that we can do to try to lessen what I think will be probably a significant uptick after the Christmas holidays. So will things progress and get worse? Yes, I think that they will. But I think a lot of how bad that is under our control.
Dr. Traub, we'll stay with you here. If someone were to arrive at the emergency department at Rhode Island Hospital, what would be, and acknowledging the time of day is, really makes a difference here. But in general, how long are they going to have to wait at the emergency department?
So that's a great question, and the answer to it depends. When people come in and they have in a cardiac arrest, or they're having a stroke, or they have unstable vital signs, the answer is no more than minutes. We will find a bed to put them in. The problem is that for people who are coming in with more routine issues that definitely need to be addressed in the emergency department, their wait can go on for hours because we only have the capacity to see the sickest patients first. We work everyone else in as we can, but unfortunately for the people who are able to walk into the emergency department, those patients frequently are waiting for hours before they can get to a bed.
And what does that mean? I talk to a lot of firefighters, and they say that what they're seeing is, as they drive the rescues up to, say, in Rhode Island Hospital, that long ramp many people may be familiar with, that those rescues are getting backed up. A lot of people think that if they hop in the ambulance, they're going to get right into the emergency department. But I'm hearing something different from firefighters. Is that the case?
So a couple things to say about that. Number one, there are times of day that, yes, that is the case, that we have problems just because we are so crowded. We have problems processing the ambulances and bringing them and getting those ambulances in to the emergency department. That tends to be cyclical over the course of the day. And I don't think that I don't think it would be fair to say that we've got long lines out the door 24 hours a day. But yes, there are times where it backs up, and we work to get those patients offloaded as quickly as possible. But to your point about people taking an ambulance to the emergency department, there are times where people will take an ambulance to the emergency department, and if we evaluate them, they sometimes will have to go out into our waiting room because we've identified that there's no life-threatening problem, and so they'll have to wait just like others. So it's been a challenging time for us, just as it has for Dr. Levy.
Yeah, and I want to turn to Dr. Levy again, because I know part of your job, Dr. Levy, is to look system-wide, look at the beds, and look outward. And when you hear what Dr. Traub is saying about the outlook heading into Christmas and New Year's, and more people gathering, the staffing shortage, where you are with beds right now, how prepared is, I know you're going to tell everybody that, the care they need will be there, but what are the plans in place to, have more beds available, or surge, do you have to go outside of lifespan? Do you try to get people to places in Massachusetts? What do you do if you continue to see an uptick in patients when obviously it's going to be hard to surge staff if you're having the staffing problems you're talking about?
Yeah, that's obviously a very good question. And we've taken some serious steps to try to offload our critical care units. So there are a couple of things. First of all, we are rounding as a group to look for patients who are possible candidates to be moved to the regular medical floors. And so we're being more aggressive than in the past about that, meaning that every morning I make some calls to the ICU directors and the attendings in each critical care unit that day, and make it clear that we really need beds, and are there patients who they can identify who are ready to be transferred to the regular medical floor. And then we work with what we call the epicenter, which is kind of the command center of bed flow in the institution, to begin to look to see available beds to place those patients into. The second thing we're doing is we're distributing patients widely now. So previously, when we have more breathing room, so to speak, the cardiac patients go to the cardiac care unit. The post-surgical patients go to the surgical intensive care unit and the trauma intensive care unit. And the neurology patients and neurosurgery patients go to the neurointensive care unit. Now we're really just seeing one large critical care opportunity. And so wherever we have an available bed, we will place that patient so that we can facilitate the move either out of the emergency department or from an outside hospital if need be. So we're doing everything we can to improve the flow of patients from outside hospitals, from the emergency department, and into the appropriate critical care bed.
Dr. Levy, we have less than a minute left here. Just want to ask you about this. The governor said he may tap FEMA or the National Guard, I suppose, and or the National Guard to help staffing shortages. Any idea when that might happen and what that would look like?
No, I don't. I know that we're hoping for that. I also am aware of the fact that it's possible that some of these FEMA medical personnel may being diverted to areas of greater need with higher levels of unvaccinated patients. So although it would be really helpful to receive that help, I don't think we can count on it.
All right. And Dr. Traub, finally to you, real quick. When you go to the supermarket, are you putting the mask on?
I am, and I would ask everybody to do that as well. I would ask everybody to get yourselves fully vaccinated, and that's really vaccination plus a booster. And I would like to echo something that Dr. Levy said earlier on about the nurses and other allied health personnel within our organization. They are the true heroes. These are people who are stepping up, who are coming to work every day under really, really challenging circumstances. So I would ask that we all, in this season, all give our thanks to those individuals, and please be nice to them when they are taking care of you. I know that the waits get frustrating, but we're all here to help you.
Well put. Dr. Stephen Traub from Lifespan, Dr. Mitchell Levy, also from Lifespan, thank you both for joining us on Newsmakers.
Pleasure. Thank you.
Thank you, gentlemen.
When we come back, Ted and I take a deep dive into the numbers, and we're going to hear from Governor Dan McKee about the mask mandate, or the talk of a mask mandate, at his most recent news briefing. Stay with us. You're watching Newsmakers. Welcome back to Newsmakers. I'm Tim White alongside 12 News Politics editor Ted Nesi. This week, unfortunately, we're doing another COVID show here on Newsmakers. I thought you and I were hoping these would be in the rearview mirror, but they are not. I want to mention, for nearly 2 years, Target 12 has been tracking data on COVID for our track cases page on WPRI.com. And as you can see here, Ted, one of those charts that we have up, these are new COVID cases. Walk us through what we're looking at.
Yeah, well, and you see it there. That is quite a severe upward trajectory. The blue is the 7-day average. Yellow is each day's case count. And you see there, frankly, I was shocked the first day it happened. We've cracked now we're taping Friday morning, so we're a day two probably older in the data by the time people are watching this. But at this point, we've cracked 1,000 cases a day 3 times in December. Obviously, those are levels we hadn't seen. You can see there on the chart since last January. And so that's part of what's leading to the rise in hospitalizations.
And we want to compare now between this year and last year, so we can kind of put into perspective what the new cases look like. So let's bring up the next chart here, and just so everyone at home knows what they're looking at, the blue line is 2020 and that yellow line is 2021.
Yeah, and so what you see there is obviously the spike in 2020, blue, started earlier, but 2021 has rapidly made gains. Again, this is just cases. It doesn't say the severity of cases, but just in terms of people testing positive, you've had it start to get right back up into the levels we saw last year, and it's happened fairly quickly, which is part of why you hear the concern from the doctors in the first half of the show, as well as public health officials.
Yeah, and that really tells a story of when people go indoors, don't you think? I mean,
absolutely. This is a seasonal virus. We see it over and over, and it is now cold, and people are inside. And as I was talking to Dr. Ashish Shah last week, and he was saying, look, this is a Delta wave. You know, we're hearing about the new variant. The new variant is not driving cases yet here. It's these Delta cases now that people are inside. And of course, masking is way down, so there's more transmission.
All right, as you said, our first half guests, Dr. Traub and Dr. Levy, both from Lifespan, we're talking about the hospitalization numbers. So why don't we bring up that graphic here? And again, we're going to compare the 2 years, 2020, again, blue, 2021 in yellow. What are we looking at here?
Well, and look, I'd say this is in part a good news story, right? With widespread vaccination, about 70% of Rhode Islanders are vaccinated now. And you see there, even as we had seen in the first comparison chart, cases getting up into the same range as 2020 levels. You see here in yellow, hospitalizations in 2021 nowhere near what we were experiencing at this point last winter. Now, of course, the flip side of that, which is part of why we talked to the doctors in the first half, is you also don't have the capacity in the hospitals we had last winter because of staffing, which is part of why they're saying that even though that level is much lower, which is a good thing, fewer people severely ill, even that level is harder for them to deal with, they're saying, than it was last year.
We want to play a chunk from Governor Dan McKee. He held a press briefing Thursday at 2 o'clock, and on the first half, you heard from both Dr. Traub, Dr. Mitchell. They say they want to hear, they want people to be wearing masks when they're indoors. And matter of fact, you broke a story this week, Ted, that all the hospital leaders are saying there should be an indoor mask mandate. The governor has been reluctant to do that. He was asked about the hospital leaders' comments for an indoor mask mandate. Here's what he had to say.
Yeah, so the discussion is still ongoing. It's not a closed discussion, I said. All issues are currently on the table, and we're going to do what we believe is in the best interest of the state of Rhode Island, and we're taking everybody's opinion into consideration.
Right over here.
Governor, what is your reluctance to bring it back, the indoor mask mandate? If the medical professionals are now going public that they believe it should happen, what is your reluctance to do it?
Well, I think you need to continue to see where we are as a state. And let's see how people respond. They responded very well without mandates in terms of the vaccinations. Again, many people here that were listening to me saying we're going to get to 90% back in March or April were somewhat in disbelief. So we've managed this thing very well. During the Delta, we were receiving some of the same urgings, but we were able to, work our way through the Delta because of the vaccination rates, because of the behavior and the decisions that the people in the state have made. That we had the lowest, on average, the lowest death rate, the lowest infection rates in the country during the Delta timeframe. This now we're faced with going indoors. It's a new, it's new information. We're looking at it, and we're going to make the best decisions that we can based on the advice that we get.
If you wait till after the holidays, is it going to be too late?
So you don't know, and no one said that you wait until after the holidays. But I can tell you that I did talk to the governor of Connecticut today, and he's managing as we are, and by and our infection rates are a little lower than his is. Some of the metrics we're actually a little bit better, not much. We're very happy that Connecticut and Massachusetts have done what they've done regionally, because that adds to our ability to manage the situation. But yeah, just like us, PPAC is masking up. His art and music venues are masking up. Any business out there right now that wants to do that, they're free to make their moves that way. And we're just going to keep a close eye on the whole issue, and then we're going to do what's in the best interest of the people of the state of Rhode Island.
Governor. That was Governor Dan McKee on Thursday. Ted, it's clear he's getting pressure from multiple angles on this one.
Yeah, I think the governor is very cross-pressured on this. He was excited to be the governor who reopened. He's always been concerned about the effects on small business and public morale of new restrictions. We know new restrictions are more controversial than they were early in the pandemic. But he is also hearing, as you said, I heard from Lifespan told me they want an indoor mask mandate. The Hospital Association of Rhode Island wants it. The Rhode Island Medical Society wants it. Landmark Medical in Woonsocket wants it. Care New England sounds like they want it, though they were a little more wishy-washy. And that's a lot of pressure from health officials. And we also know behind the scenes there's clearly some disagreement about how fast to move between the governor's office and the health department. And so I think you see there him sort of publicly wrestling with which way to go on this and whether it's reached a point where he wants to do that and then deal with the backlash. We've already seen Republican lawmakers in Rhode Island say they will not even comply if there's a new indoor mask mandate.
All right, so as I said, we have the track cases page on WPRI.com. I urge everyone to check that out to put the data into context. That has largely been driven by our colleague Eli Sherman in Target 12. Eli is on vacation this week, so that responsibility has fallen to you. Congratulations.
I have many spreadsheets out here, which is a lot I can't wait for him to come back.
Who approved that vacation? All right,
yeah.
But you've been looking at the information. What does the additional dose data look like? And when I say additional dose, that primarily means boosters, right?
Yeah, so you can't. So I learned this week the Department of Health doesn't have in Rhode Island just a straight booster number, because some folks were eligible for an additional dose, which was maybe less than the first round that most of us got, but is more than a booster because they're immunocompromised. So they were told they needed a little more vaccine.
But I imagine the vast majority is probably
so
booster.
What the Department of Health tells me, a little over 200,000 Rhode Islanders have received some additional dose beyond the either 2 or 1 J&J vaccination doses they got. So if you take that as largely being boosted people, that's about 20% of the population that has 3 vaccine shots in them right now. And the problem is there, as you heard Dr. Traub say in the first half, a lot of medical professionals are starting to see 3 doses as the new definition of fully vaccinated. And there's a big difference between the 70-ish% 2 doses, or J&J, that most Rhode Islanders do have, which is near the top in the country, and getting that boosted dose where the vast majority of the population has not had 3 doses. So that's part of why there's concern that as this Delta wave picks up and the new variant in the wings, how does that interact with most people still having only the original vaccine doses?
And you heard both doctors in the first half urge everyone to get that extra shot, particularly as we go into the holidays. Okay, if you missed the first half, it is on WPRI.com. Our thanks to Lifespan for this joining us during this busy time. For Ted Nesi, I'm Tim White. We'll see you next week on Newsmakers.